Today is 9th of July 2020, day 15 of impatience. This is the 9-month-old female dwarf hamster. Came with the problem of ventral dermatitis. Ventral dermatitis meaning the lower part of the body, and dermatitis meaning inflammations and redness of the skins. So this hamster have the lower part of the body have the skin infection for the quite long times. Now the body weight of the hamster is 30 grams. Eating, drinking is normal. He can poop about 22 to 23 pieces of stool every day, and urine also normal. On the very first day, the body weight is 33 grams. Eating is also normal. Drinking okay. Urine and stool all are normal. For the treatment, we give the antibiotics and anti-inflammatory to the hamster to cure the infections and to reduce the inflammations and redness of the skin for about 5 days. On the day 5, we give sedations to the hamster, and we shave the whole body, and we bathe the hamster with the warm water. After the shavings and bathing, the skin is much better, reduce inflammations, and the redness of the skin also reduce. We continue the anti-inflammatory for another 5 more days. Now, the hamster stay on the antibiotics to cure the infection, but we stop the antibiotics.
Stop the anti-inflammatory?
We stop the anti-inflammatories. Today is day 15 of impatience, and you can see the skin is much better.
It's not so red or inflamed, and the hamster is not squealing and squeaking. If you compare to the first day when it came in, the hamster was very frightened about being touched by the owner. At that time, the owner consulted the vet the first vet, and the first vet did prescribe some cream and of course antibiotics and anti-inflammatory. So the owner tried to apply the cream, which must have caused pain. Let go. And the hamster feels that the owner is trying to catch it and apply the cream again. So it became very nervous and squeals and squeaks and ran away and tried to bite the owner. So the owner couldn't treat it and also couldn't sleep because the hamster was making a lot of noise at night. But today, being day 15 of inpatient treatment, you can see that the hamster is much more relaxed and not so nervous when handled. Now the skin inflammation is on the lower half of the body. That's why it's called ventral dermatitis. But actually you can see that it has spread to the side of the body as well, the right side, and it shows the left side as well. The left upper body is also inflamed. As you can see, the overall the hamster is definitely much happier, but the hamster is not putting on weight. That's why I'm worried. So we have to find out why is he not putting on weight, and other than that, it's ready to go home. So this will be the conclusion of treatment, and we have to find out why is he eating much or not.
Yeah, he finished all the sunflower seed overnight.
But do you need to give more?
We give quite much amount, about 2 or 3 grams per 12 hours.
But it seems that he should be putting on weight. 15 days, in fact, he lost 3 grams of weight. But other than that, he looks quite healthy. How old is he now?
9 months old.
9 months old. So being a young hamster, you should be able to recover faster. Provided the itch must be controlled. You can see the stool is there. There's one stool pellet. So by counting the stool pellets, you know whether the hamster is eating or not eating. Although you said it's not red anymore, but it is sometimes red when the hamster is excited and nervous. Most of the time it's less reddish. It's more pink in color. Just stop now and the hamster can go home already.